Should you go to dental school? Today, let's talk about the rising cost of dental school education versus the quality of the education and whether dental school is still worth it. And at the end of this video, I'm going to tell you what I feel is the #1 problem with dental schools. So stay tuned. By the way, if you're new here, my name is Dr. Joyce Kahng. I'm a cosmetic dentist, practice owner, and I graduated with about $325,000 of student loan debt from UOP Dental School. I'm also married to a dentist, and he graduated from NYU with even more student loan debt than me. Now, on top of that, I also taught at a dental school as an assistant clinical professor in the Department of Restorative Dentistry from 2014 to 2020. While the cost of education can vary from school to school, the 3 institutions that I am most familiar with happen to be on the upper range in price, like some of the most expensive schools that you can go to. Meaning, you can go to dental school for less, but the general trend is that it is still upward trending to the tune of $300,000 to $600,000 for 4 years of education. It's gotten really, really expensive, and I don't think it's just inflation. Now, one of the things you have to understand about dental school is that it is a business. Let's say that there are 125 spots in each class, and the tuition for 4 years is $500K. That's an estimated $62.5 million of revenue for each graduating class, and there's multiple classes going all at once. So yeah, dental schools are profitable. Personally, I think where it starts to get confusing is where's all that money going? Clearly, there's a demand for this education if people are willing to pay for it, but the students don't seem to be getting the premium education that they think that they are paying for. I mean, at $500K, isn't that what they should be expecting to be receiving? So the first thing I want to dive into is the actual cost and allocation of this tuition. Obviously, a lot of this is my own opinion, but tuition price was actually the top thing that dental students mentioned on my Instagram poll of what needs to change. So let's break it down. What does that tuition actually go towards? And are there improvements that can be made? In my opinion, yes, it's kind of sloppily done. It's one thing if the tuition's expensive, but it's another thing when students still need to pay for a ton of things out of pocket that don't come out of their tuition. For example, loupes. Loupes are the magnification glasses that students wear for proper ergonomics. Basically, every kid in the class has them, but they have to pay for them out of pocket at many schools, which can be a pretty penny for a dental student. I mean, upwards of $1,000 to $2,000. So my question is, if ergonomics are so important, if loupes and magnification are so highly recommended, then why isn't there a part of the tuition that's allocated as a stipend for these loupes? Or some way to wrap this cost into the student loan so that it's not such a strain for the student to pay out of pocket. That way, students can purchase the brand that they want, and maybe if they really want to go with a higher magnification, they can pay the difference. But then at least everyone gets a pair, and there is no obligation to purchase a specific brand. Another thing that I had to pay for back in dental school, I know this is different for each school, are the burrs and the typodont teeth. So typodont teeth are those plastic teeth that we put into the models to practice our hand skills, and the burrs are the drill bits that are inside of each handpiece. Each tooth and burr costs a couple dollars. So if you're really practicing, this adds up. Now, I've heard that some schools include typodont teeth as part of their tuition, and some include burrs or some combination, but it remains to be really variable, and I do think most schools still make you pay for this kind of stuff out of pocket, which you would think that they would make it a little bit more affordable if they're encouraging you to practice your hand skills. And if you are applying to dental schools right now, that is something that I would ask if they include in their tuition. Now, on top of the stuff that you pay for that are somewhat disposable, there are also things that are rented out to you, such as electric handpieces, and for that, students are charged an instrument rental fee. Personally, I don't mind the instrument rental fee. I think it's smart and economical, but here's where I think schools are double dipping. If there is a rental fee, I believe it should be an all-inclusive fee. All major items should be able to be rented, but that's not how it is right now. See, at the beginning of every dental school student's journey, they get a kit, like a huge box full of supplies that they need to do all their projects. And what I noticed with these kits is that the kits are really outdated with supplies that students don't use or need, and they also include supplies that could have been rented out just once for the entire class. For example, in the kit at the institution where I used to work, there was a project and the students need to make their own master casts and paint their dies. Included in their kits was a bottle of something that looked like a silver nail polish and a gold nail polish. Ask me why they couldn't just have a few bottles for the entire class to share, because I guarantee that those items are not useful to the student after that specific project. I mean, I don't think the students really mind if there's things in the kit that they are actually using that are disposable in nature, like putties or Integrity or Bisacryl. But the issue is that there are so many random items in those kits that are outdated that they don't need. And then also some of the things that they do need that they use a lot, like the putty. They end up having to purchase all over again once they run out because the amount of putty needed to complete all the projects is like way more than what's included in the kit. The way that I see it, it's just pure laziness that these kits are so disorganized. Not to mention the things that we receive, the amount of textbooks that we don't end up needing, articulators, like between me, my husband, and my ex, who was a dentist from UCSF, and he went on to oral surgery, so he didn't need any of this stuff because he specialized. I have a garage full of all of our stuff, like articulators I will never use, face bows. I have so many metal trays in my garage. I have old, outdated articulators, one for dentures, one for restorative, for each person. And these freaking endo articulators, do you guys remember these endo articulators? So I could go off on these endo articulators. Sure, you need them for boards, but the parts inside are replaceable. Why not let students rent these endo articulators out and buy the disposable pieces? Because there's no reason, absolutely no reason, that I should still have this freaking endo articulator in my garage 14 years later. No. I mean, let's be real. What's really happening is that students get a bunch of junk in their kits that they don't need, and they have to pay out of pocket for things that they do need. And a lot of the stuff in their kits is probably donated to some degree, or there's a mutual arrangement with the brand. And I don't know that for sure, you know, I'm not privy to that information, but I have to imagine that schools get really good pricing on these things, right? Okay, one last thing I want to add before moving on is that at the price of $500,000, I feel like state exams, board exams should all be included in the cost of tuition, at least part 1 and part 2, if that's still a thing. I don't know, maybe that ages me, maybe they don't have that anymore, but each exam costs a few $1,000s out of pocket, and they are necessary to get your license. And I don't think any dental student is going to dental school not to get their license. So why make them pay extra for these things instead of including it into the cost of tuition? I mean, that in itself, I think, is a good reflection of the responsibility that dental schools take for you to become a experienced and licensed professional. They're just kind of like, this is where it ends, and then the rest is on you. And I know this little section was long, but all of the above, I think, are very easy and practical ways for dental schools to tighten up and not be so lazy. But let's now dive into one of the biggest issues, which is faculty pay. This one thing heavily feeds into the negative dynamic that students have with their faculty. And having been on both ends, I want to help you guys really understand what is going on here. So on the one hand are the students. These are the customers in the equation. They are paying big, big bucks for what they would assume to be a premium education and service. And in many ways, they feel entitled to this. On the other side of the equation are the faculty. Their pay would shock you. When I found out how much some of these prosthodontists were being paid to teach full-time at the dental school, I felt insulted for them. Barely 6 figures. Yes, they do get benefits, but you have to realize that these are not just dentists, they are specialists. And I know that nobody is going to dental school so that they can barely break 6 figures, let alone become a specialist. I mean, if you just think about the cost of education, the tuition that they had to pay, it wouldn't make it worth it to teach. And you know, I don't want to speak for them, so let's focus on me. I was working at the dental school part-time 2.5 days a week, some semesters, and 3 days some semesters. And just to put my salary into perspective, I made around $50K a year. And after taxes, it's around $30K, but I did get benefits. I mean, that is pretty bad. All that to say that from a financial perspective, teaching is a sacrifice, especially for part-timers like me, where I was taking away from my own productive dental practice. And at my institution, they required me to be there at a minimum of 50% or 2.5 days a week, which would make it really difficult for any other practice owners to come and be able to teach. It automatically excludes a lot of really cool, fresh fresh, relevant blood that could be teaching. And also realize that most of us younger dentists, I consider myself a young dentist still, also have our own student loan debt. So unless you are financially able, teaching is basically not an option. I know that when I first started teaching, I was driven by the fact that I was making a difference, being one of the only young female Asian faculty who was also practicing out in the real world. Like, I made both of those situations happen. And let me tell you, having a practice while being away from it over half the week was not easy. Now I'm gonna get a little vulnerable with you. I worked really hard at the dental school at first, but as the years went by, they kept giving me more and more work and I totally burnt out. It's funny because I remember there's this one older professor, he took me aside early on. He was like, "Hey Joyce, I see you. You're working way too hard. And my advice is that you stop working so hard because we are all getting paid the same amount." And when he said that at first, I was a little shocked because I'm a business owner. I'm used to grinding and working myself to the bone. But in academia, it doesn't pay to work hard. And it's easy for the job to lose any meaning and purpose over the years because the job is built to be inconsequential. Meaning if you go above and beyond, they just give you more work. And if you do a bad job, you get paid the same amount as someone who did a great job, and there's also no punishment. And I'm not saying that this is right, but in my opinion, a lot of good professors eventually leave their roles because teaching ends up being more of a political game than it is about bettering the future generation of dentists. I want to actually do a quick shout out. I think it's really important for me to do this for the good professors I've met in academia, and there are really good professors. There are professors who remain passionate about their role despite all the politics. And, I have a huge respect for them because I know how much they're being paid and it's a rather thankless job. All right, so I keep mentioning politics. So let's chat a little bit about the politics because that's what ties all this imbalance together. Again, there are the students, there are the faculty, and lastly, there is the administration. The ones hiding in their offices, calling all the shots, but not being on the field. So let's talk about some specifics of why the administration's decisions leave both faculty and students unsupported. I'll start with this personal example. There was a trimester I was assigned to teach a group of 30 plus students, between 30 to 40 students, split between me and the course director. The third faculty that was assigned to help us was an adjunct faculty, which at the institution where I was, adjunct faculty are unpaid. So it's basically like a volunteer position. And that means that they're supposed to show up, but they don't always because they're volunteering. Now, I do think most dental schools pay their adjunct faculty even a little bit, but it varies. Anyways, he wasn't planning on showing up all semester. When we let the administration know that we needed more help, they literally told us to deal, meaning that for an entire trimester, we were very understaffed and had very little time to actually sit down and teach. Like literally, I was just running around in the last 30 minutes of class, like signing things off and swiping things. And this is what I mean by lack of support. Students are promised an 8-to-1 faculty ratio. And as long as there's enough faculty on the roster, it looks like that ratio is being fulfilled on paper, but not in reality, not in the classroom. And this comes at a huge detriment to both faculty and students because they are left fighting each other for time and energy and attention that there simply is not enough of, leading to negative interactions and experiences for both. Again, I think these scenarios could have such a more positive outcome with proper allocation of funds towards faculty and also quality faculty, long-term faculty. Because the other problem is that it is a struggle to not only calibrate the faculty, which we'll talk about later, but also to retain the good ones for the long term because most are unpaid or, like I said above, they exit because the environment is not stimulating enough for them. Now let's talk a little bit about calibration. If you're wondering what calibration is, it means that if 5 faculty look at the same filling, they should come to similar conclusions for a grade. And calibration of faculty does not happen overnight. Personally, it took me about 3 years to become fully calibrated to the way that my institution wanted me to grade, which can totally happen even if I'm a practicing dentist because all dental schools have different prepping parameters and each school grades those parameters using different methods and tools. It's just surprising, I think, to a lot of people, and I think I was a little bit surprised that there's no standardization amongst different schools as to what the parameters of the preps and the grading are. So this is really the challenge of calibration. To get every single faculty to grade every criteria exactly the same takes time. And the reality is that some faculty are just more critical than others. Some of the volunteer faculty who only come once a week haven't had the time to calibrate fully. And, to be honest, some of them also don't have the stomach to give bad grades to students because they don't want to be mean, and it's a volunteer position, and they just came to, have some fun, connect with other dentists, and they just don't see it as like a real job. Not all of them. Some of the adjunct faculty are amazing. They are super calibrated, they are super dependable, and honestly, the school needs them, would not go around without them. But there are some adjunct faculty that just they don't have the stomach for it. They're nice guys, which I'm not saying faculty should be mean, but they should be giving consistent, critical, calibrated feedback on the daily work so that students can perform better for their practical examinations. And practical examinations are worth a huge part of their grade. And as someone who's graded a lot of these practical examinations behind the scenes, I think this is a huge disservice to the students when they are blindsided because they were getting perfect scores on their daily work and not realizing why they keep failing their practicals. Now, while on the scene, I also noticed that there are different types of students. Some students actively seek out the easiest faculty to get their work signed off and just live a good life, while some students actively seek out the harder faculty to get critical feedback so that they can improve week after week. As you can imagine, these two groups of students will obviously move on to become very different types of dentists. So what I want to say is that this is not just all on the faculty or the administration. Students need to be proactive about the quality of their education. And I've noticed that many don't even show up to class, don't show up on time, don't show up prepared, are rude, and have horrible attitudes. I mean, I've dealt with my fair share of future dentists who spoke to me like I was born to serve them. So just as there are good faculty and bad faculty, there are good students and bad students. The problem is that at 500K, they are expecting to be catered to. And it leads to this general sense of entitlement, which is completely counterproductive to getting a good education because the reality is that the faculty are understaffed and underpaid. My advice is that at 500K of tuition, make sure you take ownership of your education and take advantage of the resources provided to you. Because there are a lot of great resources in the dental school, even though I haven't gone over any of them. There are a lot of great resources if you know how to utilize them. And this single skill will help you to be more successful in your life after dental school. All right, let's move on to problems with the curriculum. And just as a reminder, I went to a 3-year dental school and I taught at a 4-year. So I have an entire video on the differences between a 3-year and a 4-year dental program if you want to watch that one. I'll link it up here. But I'm just going to say straight up that a lot of the 4-year curriculums can be improved so that they're more practical and useful for real life dentistry. So no more GV black amalgams or spending an entire year perfecting acrylic provisionals. And I'm not saying don't teach these things, but maybe put less of an emphasis on the things that they are not going to use in the modern world and not an entire trimester. I also think the curriculum could benefit from a little continuity from the sim lab to the clinic. And those of you who are not in dental school, the sim lab is typically the first 2 years of dental school where you're practicing on models, and the clinic is where you graduate to where you can now practice on real life breathing patients. Also, I know that this dynamic is different for each school, but for example, if students are learning how to do acrylic temps in the sim labs but bisacryls on the clinic floor, it feels like we're not setting them up for success. Everything learned in the sim lab should be a directly transferable skill that they can apply in clinic. If the pre-clinic curriculum was cut down to only the things that a modern dentist would need to practice out in the private practice, I feel like most programs could actually go down to a 3-year program the way UOP is. Now, I'm not saying that all dental schools should go down to 3 years, but I feel like that 4th year could be better utilized as an advanced year, almost like a residency that is filled with procedures and guidance that could help bridge the gap between school to going into private practice. And we'll talk a little bit more about this later. Now, first, I want to talk about clinic because in my opinion, this is the #1 problem in dental school. What's the point of going to dental school if students don't graduate feeling prepared to go into the real world? Like, I know dental students that have graduated with only 1 crown under their belt. 1 crown. And if you're not sure why I'm making such a big deal about this, a crown is considered bread and butter dentistry. It's like what we do out in the real world. Fillings and crowns. Every dentist, that's like what we do as our bread and butter. So if you're only getting one crown before you graduate and your next crown is on a paying patient, that's a little scary. And I'm sad to say the student should have never been allowed to graduate. And I'm not saying it's their fault. I think the schools need to be held accountable for their lack of experience. There needs to be standardization for requirements between all dental schools. And students should not be barely hitting their requirements. They should be graduating with flying colors. They're paying $500,000 for this education. Also, because I stopped teaching in 2020, I know that I don't have the full picture as to what dental school is like right now. So as part of this video, I pulled dentists and dental students from Instagram to further identify the problems that they experience with dental school. Okay, number one is that hitting those graduation requirements is sometimes a challenge because the cost for patients to do the treatment is still pretty high. And that really sucks because when a patient goes to a dental school, it's supposed to be a win-win situation for both the patient who needs affordable dental work and the student who needs the experience. And as is, the only ones who are benefiting from this arrangement are, again, the administration. To me, it looks like they're double dipping on the situation. In fact, I might argue that once the students enter the clinic, they should be paid for the work that they're doing if that work is generating income for the school. Or they don't need to pay the students, but the school needs to incentivize more patients who need work by reducing those fees for them. Because these patients could easily go to a DSO and get competitive pricing without going through all the loopholes that dental school creates. So dental schools need to be able to compete. And students should be guaranteed a minimum level of patient experience. I personally don't feel that acquiring patients should be their job. And it's funny because I've heard of dental students saying that it is the job of the students to bring patients in, kind of like how they would in the real world, but no, it's a completely different situation, especially when they are paying $500,000. Again, comment below if you have thoughts on this, if you agree or you disagree. The second biggest complaint was that there was not enough experience with the more difficult procedures that students actually want experience in. The top four are implants, third molar extractions, root canals, and of course, cosmetic dentistry. And in some schools, dental students graduate with very little experience in some of these, especially if there's a specialty program at that school. For example, I remember when I went to dental school at UOP, there was no endo specialty program. So we got to do a lot of endo as dental students. But now that they have an endo program, I'm assuming that a lot of the root canals need to be referred to the endo program. I know the endo programs need to eat too, but I still feel that students should have the ability to try these cases despite whatever specialty programs are there, especially because these are the procedures that they will ask at the interviews, the job interviews, whether you have experience in. I remember when I was a new dentist, every single job that I applied to, they wanted experience in third molar extractions and root canals. And at this point in time, with all the dental students that are graduating with only one crown or one root canal, how can they approach these interviews with confidence? I mean, the reality is that the school is expecting that these students go to residency. And I think that's a shame because the dental students spent 4 years in these institutions and the time was not allocated to be efficient so that they could actually learn procedures that they want and need to learn. Again, this is another example of the dental school being like, we care about you, we care about you, we care about your education. And then at a certain point, they're like, bye, good luck out there. Okay, the students also wished that there was more of an introduction to the technology that they would be working with in private practice, such as digital technology. Now, I recall when I was in the sim lab, there was an entire room full of CEREC machines and digital dentistry technology on the clinic floor. But I don't know how often it was actually used in clinic. All I know is that the students in the sim lab would rotate downstairs to scan their models and get experience with the CEREC. Personally, I have to imagine the biggest issue with digital dentistry is that it's not having the actual technology in the school. I mean, I'm sure that's a big selling point when people are interviewing, saying that we have all this digital technology. The problem is probably having clinic faculty that don't feel comfortable using it. And as someone who has adapted digital technology into my own dental practice, there's a huge learning curve for some of these machines, which if you don't use them in practice, it's really hard to feel confident and to also teach somebody else, which makes it easier to revert back to the tried and true, which I got a lot of comments from dental students saying that depending on the faculty, they're always forced to do old school dentistry, like amalgams instead of composites. And again, it really comes down to how up to date the faculty is. And for faculty who are practicing out in the real world, this may not be as big of an issue, but for faculty that are full-time in a dental school, it may be a little bit hard to keep up with all of the advancements in dentistry and make sure that that translates on a patient. Whereas in the sim lab, if students come down and they scan their models and use a digital technology, it's all good and well because it is a process that they are learning. However, on the clinic floor, there's more pressure for the technology to come out as a good result for the patients. Okay, I have one more that I'm going to talk about, but if there are more things that you think should be different about clinic, leave a comment below. The last thing the majority of people commented on Instagram was that they wish students got more business training prior to graduating dental school. I don't know if it's changed. Like I honestly don't know how much business is talked about in dental schools at all. I remember in my last semester of dental school back in 2009, we had to do a presentation where we discussed a potential practice that we might build, and we were doing like some sort of presentation that you would do to a bank to get a loan. But some of the prompts were like, how big is your practice, the demographic analysis of the area you want to be in, and how you planned to market the practice. And these were all questions that at the time just went way over my head. Like I had no idea how to answer any of these questions. Luckily, my mom was a practice owner, so I just asked her. But even when she told me the answers, they didn't make any sense to me. It's because my brain was like, I'm not going to be a practice owner. I don't care about this stuff. And here's the thing, I could see that happening in dental schools if they did make business training a requirement for the dental students, because not everyone is going to go on to be practice owners or care about these types of things. But I think it would be useful for students to have a resource that guides them through things like startup dental practices, how to look at a P&L, what to look at when acquiring an existing practice, or something like a mini MBA. And I think that it should be optional, because one thing I've learned is that if you make students take a class, they automatically don't want to do it more and they just want the grade. But if you offer it and it's actually a good class, the students who are interested would stand to learn a lot. I also sometimes think maybe it should be mandatory for everyone, because look at what happened to me. I did not think I was going to be a practice owner. I did not want it one bit. And then I became a practice owner, and maybe I should have gotten that education. I'm lucky because my mom happened to be a practice owner, but a lot of people that go to dental school do not have dental family or somebody to just ask. And so maybe this education should be mandatory, business education. Do you guys think it should be like an option or something that every dentist should get, like a little MBA, mini MBA? Let me know in the comments below. All right, so to answer my question from earlier, if dental school is $500K, where is the money going? I don't think we've answered specifically, but I think we've answered enough. You guys can fill in those blanks. And the other question, which is dental school worth it? Personally, I'm not going to dental school if I have to pay this much money, but I can see that it would still be worth it for the right individual, for somebody who is business-minded, who can, it's all about what you make of your degree. I feel like it is a little harder to be kind of like a traditional dentist, to just graduate and go into practice and have a good living. You really do need to know what's up to make this a lucrative career. And it is really possible. I have lots of friends who have opened many practices and they're doing very, very well. Personally, I don't know. Like, I always think, would I let my son go to dental school? I mean, if he really wanted to go, then sure, but I am not recommending dental school for Preston at this amount of money when the earning potential is not matching, and with all these problems with dental school and the experience that he's gonna get, unless things really change, which I hope it does. I really hope that a lot of these things change as we move forward. Okay, and if there's anything you think I missed, if you agree or disagree, please comment down below. Remember to subscribe and join the fam. I'll talk to you guys in the next one. Bye!